That's just a picture of our hallway, and it just shows you that we have an AED, which is a defibrillator device. That's not a legal requirement for us to have in our offices, but it will be soon. We feel that just for the safety of our patients, we should take into account every bit of emergency equipment that's out there and training. So that's just to show you that. The next picture is our CEREC machine. This is this little block. These are two little drills that will actually make a tooth as the design. That's what that CEREC machine is. It makes the tooth, and that's the little blank that's there for it to make the tooth. So that's kind of our 3D printer. This next picture, it's a close-up pic, JPEG. We have a technology that allows us to take real close-up pictures of teeth using something called an intraoral camera. There's another picture of an intraoral camera in this set of pictures, but that allows us to really diagnose fractures, broken teeth, early detection things. What it also allows us to do is that if an insurance company should ever question the validity of a claim, we have the ability to show them what the tooth looks like prior to any treatment. And that helps our patients get their claims reimbursed. This is just another picture of our 3D planning software and their ability to look at the entire jaw and skull. Next photo is called a CT scan truck. There's sometimes where a patient has a very busy schedule and can't come out for imaging. So we work with a company to bring the imaging to them. We have patients that are, will work in Manhattan, and it's hard for them to get out during the day. So this company will go to the patient's office, park on the street. The patient will go to the truck for 5 minutes, get a scan, and that scan has been emailed to us that evening. So we have the ability to bring as much dentistry to them and work with people's schedules as much as possible. That is a picture of my dad in 1973 in the free clinic at New Jersey Dental School, and that's in Jersey City right there. So that's a great picture in our office, and I keep it on the wall and love looking at it every day. The next picture is called dental laser, and we practice laser dentistry in our office because it allows us to do a lot of procedures differently than what we do, than what would be done traditionally, which would be very painful periodontal procedures, periodontal surgeries that require a long time for healing and then typically very painful. We can accomplish a lot of what is done traditionally with a dental laser that healing is done over a day and very little loss of work and very little discomfort. And that's one of the reasons why we have this technology to offer our patients. The next picture is Dentrix. That is just a picture of what our practice management software looks like. And that's what we use to have a digital record for our patients so that we keep all their records unified. So that means there's no paper, and that also means that there's nothing lost as far as medical history, medications that we've given them. If we've been watching the things, watching a tooth, we can make a note of that, and there's not many holes in the process of patient care. And that's very important to us and our patients. This next picture that says digital panoramic machine is it's a machine that we use to take full head x-rays and also do scans as well. That is a really neat machine. Oftentimes for us, when we want to match a shade of a tooth, there are shade tabs, like a color palette, like any artist would use. But this machine also allows us to verify a shade using a scanning technology. It actually reads the tooth shade. What the Velscope does is it is an early detection device for oral cancer. What that does, typically when we see cancers in the mouth, it's too late. This has allowed us to have early detection for oral lesions. We've found in the past year 3 oral cancers with this scope. And because we found them, they were removed and the patient's doing fine. And this is probably one of the most important pieces of technology in the office that we have.